Hello, I'm Amber.
And I'm Neha. We are parents of a gifted child who's on autism spectrum.
Through our YouTube channel, we want to help parents with children on the autism spectrum learn more about autism, avoid a lot of myths that are there, as well as provide tips and strategies that can help ease the parenting journey for you. So, in this video, we are going to share our experience of a dental visit for our child and how it went about. Uh, so, till now, we have had like 4 5 dental visits with almost 3 different dentists. So, we want to share that experience with you. So, our son was around around 5.5 years old when he had the first time we had the need to take him to a dentist. We started noticing that he was putting his finger in his mouth again and again and trying to touch his teeth, and probably with tongue he was trying to scrape his inside and touch it again and again, and as if something uncomfortable was there. And so we tried to open his mouth, and we could figure out that there was some kind of a decay, and so we decided to show him to a dentist. So there was this lady dentist in our building only, and but she of course takes care of adult patients, but we still managed to call her. She came home. It was a comfortable environment for my child because we were at home only. So with a little bits of struggle, he managed to open his mouth, and the lady dentist got to see, and the picture wasn't very great, and we were immediately referred to a pediatric dentist. The first pediatric dentist where we went to was a good one, no doubt, but the ambience of that clinic wasn't too great and not a very child friendly ambience. We showed our son to the dentist, and he recommended us. He did the x-ray with great difficulty. We had to hold our child, and Neha managed to grab him. I managed to grab his legs, and he laid down on the dentist chair, and he managed to do the x-ray and all, and found almost 4 to 5 teeth which required some kind of a dental intervention. We also decided to take a second opinion, and we were recommended a kind of more child-friendly clinic by dentist by a few friends, and we went there. The ambience there was pretty nice, inviting. There were a lot of toys to keep the children distracted, and but when we went, there were other children before us, so we had to wait for an appointment. And my son had never, and he didn't expect out of that place that how that he is going to see a dentist. He thought it's like a play area. So when his turn came, that is when it hit him. When he saw the dentist and wearing his mask and the face cover and everything, that this is not a great place, and he started getting that anxiety. So when we took him when we got him checked up, we were told the same thing in the second opinion also. And now the point was how to get this thing done. There were several options which were there with us, but seeing how difficult it was to get him checked, the doctor recommended him to do the procedure under the general anesthesia. बोलना है तुम्हें?
It was a shock for us because we don't expect things to be done under general anesthesia, anything to do with mouth. We never expected that. But later on, we got to know it is fairly common. This is something which happens when you need it. So we decided to finally go in for that. He also suggests that because he said since there are so many decays, we need to do it in one go. We can't make the child sit and come for multiple sittings. It will become very, very difficult. But before we could actually get into the procedure, there was some swelling also on his face, and there was infection. So the doctor did suggest that we give him antibiotics before we take up any decision to go in for the procedure under anesthesia, general anesthesia. So we gave him antibiotics for 5 days, and everything subsided. The infection got better, and he also told us what is the good part about the surgery under the anesthesia is that he can clear out. If he goes in, he can clear out if there's any other infection. They can really clean it up properly, and then they can restructure the whole thing and whatever is needed to be done. So once that was done, uh, he got all right. Everything was okay. We were asked to do the follow up after a couple of weeks, and we went there. Again, it was a little difficult because he did not like to sit in that chair. He's already had that traumatic experience, he feels, and again, we had to take him there. So we again managed to hold him because he was still small. It went on, and then after this was done, we were able to focus more on his, or we were told to focus more on his oral hygiene, and we were able to make him brush properly. He was sort of gargling with salt water, saline water. We were asked to do that. We did that for quite some time.
Especially after he used to eat sweets, make sure that he used to at least rinse his mouth.
Rinse his mouth, and if we are outside somewhere, I would make sure that he drinks a little water, and I would ask him to just sort of take it in. And then after a year, we again went up for a checkup, and we were given the option of fluoride coating varnish, which they say keeps the child protected for about 6 months or so. That the time varies. It depends. A lot of different opinions that it can happen for 3 to 4 months, or it can even continue up to 6 months. Some even say that 12 months. I believe it's very, very different for everybody else, and everybody, whoever's experience is different.
We would request you to talk to your dentist about the fluoride coating, because while the internet and say that it's supposed to protect, but as Neha said, the results are they vary how effective it is. So we would actually recommend you to talk to your dentist about it if you want to get it done. But since we had these multiple traumatic experiences with the dentist, we wanted to make sure that if we wanted to be a little extra sure and make sure that as if this coating prevents it, then we don't have to visit the doctor again. We wanted to minimize our doctor visits. But when this fluoride coating thing happened, because again he was very scared, and this time when he went, he was a year older than this first visit, so he was much more stronger, and it was difficult for us to hold him. He was all reluctant, and the entire checking up and coating took at least 7 to 8 minutes, and managing him for those 7 to 8 minutes was very, very tough.
And because the child cries so much, you feel pretty bad, because he's all anxious already what is being done inside his mouth. So once this was done, we were asked to come again, because already at this time he did say that there is one permanent molar which has started to get some kind of staining, and he called us after 2 months for that.
So this time we had time, and we, based on our previous past bad experiences, we wanted to make sure that we go a little more prepared for the visit. So we decided to start preparing him. Did a little research on it how to do that. So what we started doing was we started pretend playing a dentist game with him every night after dinner, where we used to tell him to sit on a chair and open his mouth, and we would start taking a little tools of toy made of from his toys, a little torch, a little stake, and we would Neha would or me and me would act like dentists and the assistant of the dentist, and we would make him open his mouth. One thing we realized, even for potty when we were potty training, when we were helping our child prepare for the haircut, by the way, we have prepared a video for that, and I'll put the link in description, is that predictability is something he takes in easily. If he knows how long a procedure is going to last, then he can control himself. So that predictability is very important for him. So what I generally do with him is that he loves countings and numbers. I tell him that okay, we're going to count till say 20, 30, whatever, 50, and then this thing would be over. So then he has an idea that okay, this thing is not going to last very long. It will get over eventually. So that predictability game we started playing with him when we were doing this dentist play pretend thing, and that after you have to open your mouth for 30 counts, and then this whole experience will get over. So we went a little more prepared this time, but when the final moment and when he went inside the clinic, of course, since he had gone there many times before, he did recognize it, but he was more calm inside while he was waiting. We also took the first appointment so that the anxiety of waiting for long, while other patients or kids are inside, is reduced. So we took the first appointment, and while he was waiting, he was pretty fine. He was noticing the various toys which were there at the clinic, and he was not as anxious as he had been before. But when the final moment arrived, when he had to go inside, it was, we thought it would not be as bad after so much preparation, but it was a little bad. But again, much better than what it had been last time. With some difficulty, he did allow the dentist to open his mouth, and look inside. In fact, he even grabbed the instruments that dentist has and started putting inside.
Because he had an idea, and then he was doing it well, and then he allowed the dentist also to touch him, and he started counting himself. So we decided that we'll count for him. So he was counting, and then finally we were able to sort of again grab him, put him down, and make him sit to do the checkup, and it was still more successful than what we had.
Not that great, but yeah, a lot more successful. And the dentist has again said that there are three, four more teeth that require some kind of a intervention in the next few weeks, which is a little surprising for us, because we were told that the dental fluoride varnish that we had done on his teeth should protect him, but somehow that doesn't seem to be working. Within 3 to 4 months, the dentist feels that he needs another procedure. This time we don't want to go for a general anesthesia, because I think general anesthesia becomes a long process. It's most of the clinics don't have that, and they have to refer to a hospital and use the services of a hospital, where the hospital provides the anesthetist and other support to get that surgery, and it becomes very expensive at the end of the day. So some of the options that we have discussed this time is the use of sedatives, where the child has to take a fast and then go. Laughing gas is something again which is supposed to, at least for regular children, we have heard it works very well. And but again, as per the dentist, to administrate laughing gas, he needs to sit quietly for some time. So for that, sedatives will work. We would recommend, whenever you have a dentist visit and you require a bigger procedure to be done, always explore all the options which are there, like sedatives, laughing gas,
and whatever
general anesthesia.
Whatever they ask them for the recommendations, and then go for that.
But also take a second opinion, because even now we will be taking a second opinion, because sometimes you never know whether what is being told to you is actually correct, or is just a money making thing. So always take a second opinion, and always try preparing a child well in advance. There are a few videos which we discovered later on YouTube, and in fact even showed those videos to him on YouTube, where you have these children at the dentist and the dentist is checking them up, so that helps prepare the child a little better. In fact, this time when we went, we took the photo of the actual clinic also, the actual dentist chair, so that next time when he has to go, we can show him that, and he's a little more prepared, and we hope that goes better next time.
Yeah, so hope you gain something from our experience, and you are able to tell us more about your experiences also. Please put them in the comment section so that we have a better idea, and thank you for watching.
Thank you.